911, what is the location of your emergency?
I'm hearing these voices in my head.
Things going on right now, man, and I'm tripping out.
More Americans going through a mental health crisis are seeking emergency care.
I have homicidal thoughts, and I need to get my meds corrected.
We're learning when they arrive at the emergency room, they may not get the help they need.
I'm trying to ask people for help, and I feel like I ain't getting it.
I used to tell my mom, I wish I had a terminal illness instead of mental illness, because people understand that.
44-year-old Brea Birch suffers from bipolar, post-traumatic stress, and dissociative identity disorders.
This is my mom in the passenger seat.
Her mother died in 2017.
My mother was my best friend, and losing her made me not want to live anymore. I remember sitting down at my table and getting my pills out and started to separate all the ones that would hurt me out of the pile of pills. I was trying to kill myself.
She went to her local emergency room in Manhattan, Kansas for help.
Unfortunately, there aren't many places in Kansas where you can go and get screened. You have to go to the ER.
Across the country, mental health ER visits are up 66%, according to a study from earlier this year.
They're not getting the care they expect because our rooms are full.
Robin Chadwick is president of another hospital in Kansas, Ascension Via Christi St. Joseph in Wichita.
This team is an awesome team. Every single day in this facility, we have patients who are suicidal or homicidal. On a good day, there will be 10 behavioral health patients waiting in the emergency room. On a really bad day, there might be 30.
Nationally, bed capacity for psychiatric patients has plummeted in recent decades. Care outside the hospital can also be hard to find. A federal audit this spring found mental health patients with insurance experience challenges finding in-network providers. Patients also face a shortage of psychiatrists willing to accept Medicaid. All this while ERs cope with the recent surge in behavioral health visits related to substance abuse.
Substance abuse and mental health have always gone hand in hand.
Add it all up, and you get patients with nowhere else to go, flooding emergency rooms.
Whatever that mental illness is, if you can't get help, the situation gets worse, it escalates. The emergency room is the safety net for everything.
Problem is, we found hospital emergency rooms are struggling with the influx of patients who, like Birch, are desperate for help. The ER by her in Manhattan, Kansas, was like many places you'll find nationwide that don't have a behavioral health unit.
They couldn't find me anywhere to go.
She was so desperate for care, she steered herself in a wheelchair toward traffic outside the ER so she could get into a state hospital.
I did what I had to do to get help. The ER, they're not equipped to handle mental health.
Our analysis of CDC data found of all psychiatric patients who go to the ER, about 11% leave without a follow-up plan for care. 11% may not sound like much, but it equals hundreds of thousands of patients in mental distress leaving the ER, released without a referral. Chadwick says the reality is more people in crisis are coming to the ER, and too many hospitals aren't able to meet the need.
I'm getting from you that you totally get why mental health patients are fed up with emergency room care across the country.
I completely understand it. This is 7 West. It is one of
Chadwick's hospital in Wichita built a new space to expand behavioral health treatment.
There are special screws used that cannot be pried out, because a screw could then be used to scratch yourself, hurt yourself.
To prevent suicide by hanging, doors have special handles. TVs don't have exposed cords.
So this is a great resource that you all have.
It is a great resource, and it stays full all the time.
The build-out took money, about $60 million, and it took determination.
It has become very personal. My oldest daughter, who's now 22, attempted suicide twice as a freshman in high school. And it really hit home, and she's what drives me.
Outside the hospital, people here in Wichita are working on new ideas for how to keep psychiatric patients from needing the ER in the first place. Wichita is in Sedgwick County. Leaders here established a rapid response team to help with mental health-related 911 calls
I don't want to hurt myself, so I need help.
when people may not need the ER. They also set aside $15 million for a new mental health community crisis center. County Commissioner Lacey Cruz envisions this area could be used to help psychiatric patients before they need the ER.
Caring for people with mental illness, what does that look like? What we need really is a sort of a one-stop shop. Let's make sure they have transportation to get there, and then let's follow up with them. You can't teach someone to swim when they're in the middle of the ocean drowning.
The county has not settled on when and where to build the new center. Back in Manhattan, Kansas, medication and a caregiver are working for Brea Birch for now.
I have to keep reminding myself that I really don't have too much to complain about right now, because I have a roof over my head, I got food in my fridge and cabinets, and I have money in the bank, and I'm just doing a lot better now. And I just hope I stay on this path.
A lot of people like Brea Birch out there in Wichita, which is in Kansas where Brea Birch is. They think the solution really is to both increase hospital bed capacity, but also to boost resources in the community to help keep people from needing the ER in the first place. Chance.